The thing that excites me the most about the new Women's Hospital is an opportunity to bring together the best of care in terms of obstetrics, perinatology, and neonatology, to have a program that's dedicated solely to the care of newborn infants and women. A level 3 NICU means that we'll be able to take care of some of the sickest babies, premature babies that are born. Neonatal care of newborn infants is divided into 3 levels. Well baby nursery is considered level 1 care. Moderately sick, larger preterm infants are cared for in level 2 nurseries. And level 3 nursery is where the smallest and the sickest babies would go, either premature or even full-term babies. And what we'll be able to do is take care of the vast majority of sick infants at birth. One of the primary benefits is that the sickest mothers will be able to be managed by their obstetricians and the perinatologist, the high-risk obstetrical specialist. And then once the baby's born, they'll be able to stay within the same facility and just move across, to another floor, at which point then we'll be able to continue with the baby's care. And at that point, we'll be able to utilize the specialists, the neonatologist, the nurses who are specializing in newborn care, as well as all the other support staff, the respiratory therapist, the phlebotomist, a whole collection of people that work together to help take care of those babies without having to move them any great distance. They'll be all there in the same place. Most hospitals only have a level 1 nursery, a well baby nursery. Many hospitals will be able to take care of mildly sick, moderately sick children, large premature babies or term infants in what are called level 2 nurseries, but only a much smaller number of hospitals actually provide level 3 care. There are only a few level 3 nurseries in Omaha and only a handful in the entire state and in this region, and so we'll be able to provide care for all those babies. I was given an opportunity to get involved in the project very early, almost 3 years ago. I had a chance to meet with some of the obstetricians and the perinatologists, along with some of the Methodist administration. And from that very first meeting, we've been involved in meetings that were occurring on a monthly basis for the last 3 years. So we started at the very beginning. There was just a concept that we wanted to build a women's hospital out west, and how we were going to build the NICU was discussed from the very beginning, and my partner and I were part of that initial conversation, and we've been meeting throughout. As the plans were laid out, the concept was developed, as the idea of how we wanted to structure it was done. Well, then we moved on to the actual drawings with the architects and the plans. I've been involved from the very beginning all the way through. Well, being able to participate from the very beginning has allowed us to design a state-of-the-art intensive care nursery. We're able to incorporate structural design elements that would allow for optimal developmental care of the baby in terms of how much light the baby would be exposed to, how much noise the baby would be exposed to, as well as being able to construct a nursery where there is more privacy for the family when they're there visiting or being with their child. There's space in every room for the mom to stay and even sleep close to her child during its hospitalization. We were also able to look at the layout, the floor plan of the nursery, and incorporate workflow that would make it easier, better for the staff to care for all the patients in the nursery. The design of the nursery that we created is part of the leading edge of of how nurseries are being designed today. Not that many years ago, nurseries were still being designed as big, large rooms where you'd have many babies sitting right next to each other, sort of like the old-fashioned hospital wards. And today we create private rooms. So every patient, every baby will have its own room, a private room for the baby to stay in and for the family to be with the baby. It's not that common yet. One of the nice things about how this whole process has gone forward is, as we came up with the concept and then worked with the architects to actually design the floor plan, then the engineering people built mock-up rooms for us so that we could actually see how the place physically laid out, and we could actually stand in a space and go, you know, that's not the right spot, and we could move and adjust things so that we could optimize the design and the functional utility of the room, as well as get the concepts of what we wanted down. I'm frequently asked by people that, is it true they're really building a women's hospital in Omaha? And the answer is absolutely. I mean, there's a huge building going up out west, and then they want to know, well, what are you going to be able to do out there? And I tell them, we're going to be able to do virtually everything we need to care for newborn and sick premature babies. And that opportunity to do that is really special. I mean, not many places get to have a women's hospital, and we're lucky that in Omaha and in this region that we're going to have a hospital dedicated strictly to the care of women and their babies.
I think my biggest anticipation about opening a women's hospital is having a place to go to that is specifically dealing with women. I specifically deal with complicated pregnancies. I think it's very nice to have a place to go for women, and they don't have to worry about anything else. We can take care of every problem they could ever potentially have from their pregnancy. So to have that in one place that someone knows they can go to and get the care that they need, that's really what I'm looking forward to. I think the hospital is going to be geared to looking at those things that women need to have done, make sure they get them done, and that it's done in a manner that is both professional but by the same token comfortable for the women. I am presently part of the March of Dimes. Also, we are setting up informational packets for people. Certainly the people I deal with that have had premature babies and stuff that are part of the March of Dimes are very excited about getting involved in seeing this get off the ground, since there really isn't anything like it anywhere in this area at all. We're trying to make sure that, certainly from the side of the women with complicated pregnancies and premature infants, that we have state-of-the-art care for those patients. It's actually hard to wait until next year for it to open. You'd like to see it open tomorrow and get things going, to be honest.